Good morning, everybody, and welcome to our first online workshop. We're trying some things differently. We're trying some new things out. The world that we live in today is a lot different than, what we're accustomed to and what we're used to. So this was one of the best ways that we thought we could provide workshop services to you guys. I wish I was able to share the PowerPoint with you guys, but I'm unable to do so. So bear with me for as long as you can. I'm going to go through the workshop that I've created for you guys, and then we can discuss maybe emailing the PowerPoint to you guys afterwards, or coming up with another plan for you guys to be able to access it on Facebook. We're going to try a few things. So again, bear with us. This is all new for all of us and for everybody. But I would like to say, for those who have been able to join us today, thank you for joining us. Again, the world that we live in is different, so we have to try to make adjustments. That's why the title of this workshop is Wellness at Home. This workshop will surround around multiple topics in regards to what we need to do in regards to dealing with the situation that we're in now, getting some information about the situation that we're in now, what that situation looks now. So we're going to go through quite a few of those different aspects today. I may be choppy and I may be stopping, but remember, usually I'm presenting in front of people, not just sitting at the desk. I'm presenting to myself. So it's all kind of new and weird, but we're ready to go, and I'm happy to have you guys with me this morning. Okay, so in regards to any questions that you guys may have during the PowerPoint, if you could, I think you'll be able to type during the watch party any questions that you have. If you're unable to do so during the watch party, you guys all have our cell phone numbers. You can text me, Jennifer, or Sadie in regards to any questions that you have about the workshop after the workshop is presented today, or even during the workshop, feel free to text, okay? We'll all be watching together. I'm just presenting a little bit earlier, but yes, we'll be watching the workshop together, so we will also be participating with you guys, okay? Let's get started. So welcome to our Wellness at Home workshop, the first workshop, our first DS employment workshop online. This is very cool, very epic. Let's get ready to rock. Okay, so welcome again to the first online workshop for the Inclusive Community Employment ICE program. In these times, we have to figure out how to stay connected and to stay distracted from the negativities of the world. Staying positive, keeping healthy, and keeping active mentally and physically is what is needed. I'm sure that you all will have lots of questions about what we are doing and this will work and how this will work on a regular basis. I'm here to tell you that this is a learning experience for us all, and we will make adjustments any way we can to accommodate you all. Again, welcome to our first Facebook workshop. And bear with me as I change through the slides. I know there's going to be a little bit of a pause between each segment, but again, guys, bear with me, okay? With so many changes happening in the world today, which I know most of you have had a hard time with, what is the new normal? That's what we're going to be talking about today. The new normal that we have to live in. Why is there a new normal? What are the risks of our new normal at this time? And how do we prevent the virus from spreading? And how can we deal with this situation? So let's talk about that a bit and maybe have some discussion around it if possible, okay? If we can't have discussion about it, that's okay. A lot of this is going to be me talking anyways. Again, please enter your questions either through text, or if there's an area to do it during the workshop presentation, please feel free to ask your questions through there, or make your opinions or suggestions through there, okay guys? We do want to hear from you, so definitely pipe up, speak up, do whatever you need to do, okay? So firstly, let's cover the the main stage that I've set. What is the new normal? Well, in my opinion, the new normal is the world we live in now. The majority of us are all locked in at home for safety purposes. We have to work at home or have been laid off or can't volunteer anymore. We can't see our friends or our families for some of us. There are so many examples of what our new normal is becoming, and there isn't enough time or space on this slide for me to list them all. But what I would like to know is what you all think of this new normal. What are some ideas you all have surrounding this change in our lives? Okay, so again, post your comments, post your opinions, post your thoughts. I'm very curious to know what you guys think our new normal is. Like I said, for me, it's this situation, me working from home. That's very new. I've never been able to do so at any point in time in my life, so it's a big change. For Jennifer and Sadie, from what I've heard from them, from us talking back and forth, it's new to them too. It's a change, right? Change is always good though, because it brings better things, new experiences into light. Okay? The new normal, part 2. Why is there a new normal? Why are we in this situation right now? So we've discussed what we think our world is, and we've come up with many wonderful opinions on what that looks like to us. Now, what about why there is a new normal? What is the reason for the situation that we are in right now? COVID-19. Because of the virus spreading around the world so quickly, it has forced us as a human race to stop, slow down, and think more rationally than usual. With me bringing up the discussion of the virus, I figured that it would be nice to discuss some facts about the virus so that we all know as many real facts about it as possible. As of lately, I've noticed that a lot of you guys have had questions or concerns or opinions about the virus, how it spread, where it came from and originated. You know what? We don't have all of the details, but the details that I will be presenting to you today are from the Alberta Health Services or the Alberta government website, one or the other. I will be attaching the links to this PowerPoint, so that's why we would like to make sure that the PowerPoint is accessible to you guys so that you can also double check any of the stuff that I've researched today. Don't take my word on any of the information for sure. It's always good to do your research. The problem is we end up a lot of times doing research on different things in different areas that are random, like Facebook news, right? That's not going to give us a lot of really good information on what's happening in our world. Even sometimes Google can be a little iffy, right? But if Google's going to direct you to the Alberta government website or the Alberta Health Services website, then that's way more helpful to you guys in regards to what the actual details are about the virus at this point in time. So let's discuss COVID-19. Let's talk about it. So the first question that I would like to answer is, what is COVID-19? COVID-19 is an illness caused by a coronavirus. Human coronaviruses are common and are typically associated with mild illnesses similar to the common cold. Symptoms of human coronaviruses may be very mild or more serious, such as fever, cough, difficulty breathing. Symptoms may take up to 14 days to appear after exposure to the virus. Coronaviruses are most commonly spread from an infected person through, and there's multiple different ways, so here I go. Respiratory droplets when you cough or sneeze, close personal contact, such as touching or shaking hands, touching something with the virus on it, then touching your eyes, your nose, or your mouth, okay, before washing your hands. These viruses are not known to spread through ventilation systems or through water. The best way to prevent the spread of the infection is to wash your hands often with soap and water for at least 20 seconds. And you guys know this because the last workshop that we had with you guys in person, we had handed out some documents to you guys about washing your hands, making sure you're getting in between your fingers, making sure you're rubbing on the inside, the outside, again, through the fingers, all the way around, guys. Spend time washing your hands because that's literally the biggest way that one of the viruses can be spread, just from people not washing their hands, okay? Yes, so the best way to prevent infection is to wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose, or mouth, especially with unwashed hands. That's the difficulty with us. As humans, we're usually on a regular basis touching our faces thousands of times a day, or hundreds of times a day, excuse me, and we don't notice it. You don't notice how many times a day you would touch your face. As of lately, I've been trying to catch myself, but when I'm at home, it's a lot more relaxed, right? I'm not really worried about who is touching what because it's pretty much only me here most of the time. So, guys, you have to remember, hands, don't touch your eyes, nose, or mouth, okay? And avoid close contact with people who are sick. So if you're aware of somebody who's sick out in the community, the last thing you want to do, guys, is be approaching them. You also want to cough and sneeze into your sleeve and not your hands. And stay home if you are sick to avoid spreading illnesses to others. Okay, so those are some of the ways that you can stop the spread of it. But just to review, I want to repeat again what COVID-19 is, just so that you guys have an idea. Okay? So, COVID-19 is an illness caused by a coronavirus. Human coronaviruses are common and are typically associated with mild illnesses similar to the common cold. Okay? And then I've already discussed the symptoms, and there's assessments that you can take online to even see if you have the coronavirus or just the common flu. All right? And we also provide you guys the link to be able to check yourself and test yourself. If for those of you who have not had access to that link, we can provide that link for you, again, through email, or hopefully I'll be able to attach it to the PowerPoint when I am done and send that off to you guys. Okay? Moving on. So now that we've gone over what COVID-19 is, and we've discussed some of the facts of the virus, some of the symptoms of the virus, let's discuss how Canada is dealing with the virus and how the virus spreads, what the risk is to Canadians, and who is the most at risk to the virus. Okay? How is Canada dealing with COVID-19? The health and safety of all Canadians is the government's top priority. The Public Health Agency of Canada is working with provinces, territories, and international partners, including the World Health Organization, to actively monitor the situation. Global efforts are focused on containment, limitation of the outbreak, and the prevention of further spread. Canada's Chief Public Health Officer of Canada is in close contact with provincial and territorial Chief Medical Officers of Health to ensure that any cases of COVID-19 happening in Canada continue to be rapidly identified and managed in order to protect the health of Canadians. So just from me reading that, you can tell, guys, that the government is continuously working on making sure that we stay safe and making sure that we stay healthy. And they're not just communicating with people here, but people outside of Canada. Canada's National Microbiology Laboratory is performing diagnostic testing for the virus that causes COVID-19. The laboratory is working in close collaboration with Canada's National Microbiology Laboratory sorry. Sorry. Give me a second, guys. Sometimes I mess up a little bit, but again, bear with me. I'm going to read that sentence over again. I had just bounced back. So, the laboratory is working in close collaboration with provincial and territorial public health laboratories, which are now able to test for COVID-19. A summary of people tested in Canada is available and updated each week on the Alberta government website. This testing summary represents information collected by the laboratory and not the total reported cases in Canada. The remainder of tests not reported here are still being resolved. They're still working it out. They still need some time to figure out how they're going to find out who has it, who doesn't have it. Okay? So, should there be any differences with the national case count compared with testing numbers reported by provincial and territorial public health officials, provincial data should be considered the most up to date. Okay? So whatever you find on the Alberta Health Services website or the Alberta government's website about COVID-19 and how many cases have popped up, they actually are doing a count, right? I think weekly it said in here. Yes, it's updated daily actually, not just weekly, it's updated daily. So when they find out how many people are sick here, they update that online so that we're keeping informed of how many people are sick, how many people are not sick, right? And again, Alberta government website, guys, is the best way for you to get your information, especially since this is the province that you live in. They will have the best explanation of things. They will have the best resources about stuff. They will have the best information of who is sick and how many people have died from this and how many people have recovered from this, right? From what I've seen on the website, a lot of people have recovered in Alberta from COVID-19. So far, so good, okay? I mean, the situation in itself is generally bad, but for the most part, the Canadian government is definitely working to make sure that we are staying safe and we are keeping safe and that everything that needs to be done is working out well, okay? How COVID-19 spreads. So I know there's been quite a few rumors about how the coronavirus is spread through the air, through just touching and everything else, and all of those things are valid, right? But let's get specific about it. Let's get some real facts and real details about how it's spread. So, the human coronaviruses cause infections of the nose, the throat, and the lungs. They are most commonly spread from an infected person through, again, respiratory droplets generated when you cough or sneeze. That's why it's really important for you to cover your mouth with your sleeve and your nose with your sleeve when you cough or sneeze, okay? Close, prolonged personal contact, such as touching or shaking hands. We are a community of people who are always usually in people's faces. This is one of those times in my life where I haven't seen a lot of people everywhere, or because when the panic started, there was actually too many people out there. Everyone was rushing to Walmart trying to get everything, and that did not help things at all, right? So now everything is extremely modified and watched, right? Depending on which store you go to, only a certain amount of people are allowed in the store at one time to kind of stay in the boundaries of the 2 meters that you're supposed to stay away from, the 6 feet that you're supposed to stay away from somebody, the 2 meters. So again, a lot of changes. So if you, again, respiratory droplets generated when you cough or sneeze, close, prolonged personal contact, such as touching or shaking hands, touching something with the virus on it, then touching your mouth, nose, and your eyes before washing your hands. So current evidence suggests person-to-person spread is efficient when there is close contact. So again, guys, this is the reason why we have to stay in our homes, okay? I do understand that it's difficult for a lot of you guys. It's kind of getting a little weird for me, myself. But we do have to do this so that the virus stops spreading. We're trying to prevent it from spreading. Okay? And the more you guys do your part in making sure that the spread stops, the better. Even family gatherings, have resulted in some people getting sick. Family barbecues or family just people getting together for this past Easter weekend. Some people definitely were put at risk, especially if there were people still wanting to go see their families, right? So we have to be careful. We have to be as careful as you possibly can. Stay away from people in the grocery stores as much as you possibly can. Stay a good distance away from those people so that you don't get them anything if you have something and you don't know it, and so that they don't do the same, right? We have to try to protect ourselves from getting this virus and spreading this virus if we have it, all right? And from what I've heard, I don't have it. None of the staff have it, so we're all okay, but it's still a really good idea for all of us to stay away from each other, make sure that the virus has time to die out, right? And we can do that by not continuously spreading it. So, what's the risk to Canadians? COVID-19 is a serious health threat, and the situation is changing daily. The risk will vary between and within communities, but given the increasing number of cases in Canada, the risk to Canadians is considered high. This does not mean that all Canadians will get the disease. It means that there is already a significant impact on our healthcare system. If we do not flatten the epidemic curve now, the increase of COVID-19 cases could impact healthcare resources available to Canadians. The government continues to reassess the public health risk based on the best available evidence and the situation as the situation changes. Okay? So the government is working continuously, like every day, daily, to make sure that we're staying safe as Canadians in regards to stopping the spread of this virus. It is still a risky virus, so the government's doing the best they can by, suggesting, or not suggesting, directing that we stay at home. If you're a non-essential service, if you're volunteering, if you're doing things that you don't need to be doing and you could be staying home, stay home. Again, it's for your health. It's for your safety. Okay? I know it's tough, guys, but we're trying our best to do everything that we can to make sure that everybody is supported in the best way that they can with this virus happening, with everything that is happening. Now, I did think that I was going to be able to do a full hour of a workshop today, but it looks like I will not be able to do a full hour of a workshop today. So what I will do is we'll try to do a half an hour and see how everybody does then. I'm kind of getting the feeling that for anybody who's watching right now is starting to slow down a little bit in interest in what we're talking about. And if you aren't, that's excellent. Let me know, right? Again, this is a new situation. We don't want to be pushing a whole bunch of stuff on you guys. We want you to at least have the information, as much information as we can provide you in regards to this situation and in regards to anything else employment related. So today we're covering the COVID-19 situation, and then I will be moving that into how we can deal with the situation and how we can better get out there. So I'll do half an hour this week, and then I'll do another half an hour next week, okay? That's probably how we're gonna do it for a little bit until we can get some more, a better look at how much is needed to put into an hour presentation. And if you guys are interested in sitting and paying attention and participating in an hour presentation. So feedback, guys, will be very, very, very appreciated after our workshop, during our workshop if possible. Let us know what you guys think. Let us know if this is a good enough video. Right now you're staring at me and the blank wall, so I'm not too sure if it's something that you are the most interested in doing for an hour twice a week. Okay, so let me know your ideas. Let me know how you're feeling about it. For the meantime, I'm still gonna go on and finish up a couple of my other slides. Again, as soon as I finish this PowerPoint with this week's presentation and next week's presentation, moving forward, I will forward, email, do whatever I can to provide the PowerPoint to you guys. I know a few of you guys have asked me in the past for my PowerPoints with all the information on them, so we have no problem sending them to you now, okay? Especially since it's just online and email. Unfortunately, we can't print it out, but that's okay. At least you'll have an electronic copy of it, which would be good too. Okay, moving on. So we just discussed the risk to Canadians, to all Canadians. Now let's find out and let's discuss who is most at risk, okay? While COVID-19 can make anyone sick, some Canadians with specific health circumstances are at an increased risk of more severe outcomes, including individuals aged 65 and over, have compromised immune systems, and have underlying medical conditions. In addition, social and economic circumstances may also be a factor in identifying someone who is vulnerable to COVID-19. This includes anyone who has economic barriers, difficulty accessing transportation, difficulty accessing medical care or health advice, unstable employment or inflexible working conditions, you're insecure, inadequate, or non-existent, there are insecure, inadequate, or non-existent housing conditions, ongoing specialized medical care or needs specific medical or need specific medical supplies, sorry guys, social or geographic isolation, like in remote and isolated communities, a difficulty reading, speaking, understanding, or communicating, ongoing supervision needs or support for maintaining independence, and difficulty doing preventative activities like frequent hand washing and covering coughs and sneezes. So let's talk about that a little bit. Let me go through each of the different areas and maybe provide an explanation of each. If I can't get through all of them today, guys, again, we will try to do a full hour workshop, or we'll be doing part 2 of a half an hour workshop next week. Again, we're just trying to figure this out, so bear with us, okay? Usually you guys know me, I can talk for 2 hours, but I have nobody to talk to, so it's a little bit different of a setup. So bouncing back to our topic, who is most at risk in Canada? I'm going to break down a few of those right now. So some people who are at risk include people with economic barriers. So economic barriers meaning you don't have the money, right? You don't have the money to go and stockpile your house like a lot of people do. You don't have the money to put gas in your vehicle, right? There's so many different economic barriers, right? You don't have the money to go out and buy groceries like everybody else, and some people use the food bank, right? And right now the food bank has kind of changed how they're providing services to the community. So I think everything's taking a little bit slower to happen, right? Difficulty accessing transportation. There's the Action Bus. I'm not too sure if the Action Bus itself is still running at this point in time. I haven't seen it around town as of lately. So we usually do get some updated information on what services are still providing services and what services aren't. So if you guys have any questions about any of those services, or haven't been able to get a hold of somebody in regards to those services and you need transportation to go and get groceries, right? Because that's the only reason you guys should be leaving your house at this time if you don't have staff doing that for you, right? Give us a shout, give us a text message. Let us know what's up so that we can help if you need the help in that area. Difficulty accessing medical care or health advice. So people who are unable to access 811 because you don't have a phone, right? You're not allowed to go into the walk-in clinics without a mask or at all if you can avoid it. There's so many different areas of this situation where, I mean, you would think that you would be able to walk into a hospital, just walk into it, but you can't. You can't just walk into the hospital. You can't just go in and say, hey, I'm sick. It's not a good idea right now. And again, it's to provide safety and the good health of everybody here in Alberta, right? Unstable employment or inflexible working conditions. So luckily for me, my employment is stable. My office has allowed me to work from home. They provided me the tools to do so. There are other people in other jobs that are not able to do so. Okay, so I think Walmart right now, they've been really good with how they are providing employment as well. A couple of our clients are still working at Walmart because they need people to stock the store. People are continuously going in there to purchase items that they need at home, right? Everybody's spending a lot of time at home, so everybody's going through the grocery stores quite frequently. Especially with a lot of restaurants being closed, there's a lot less eating out, but there are restaurants that you can still order from using Skip the Dishes and stuff like that. So again, unstable employment or inflexible working conditions. Again, some of you guys have been laid off. Some of you guys no longer can volunteer. And that is just due to the fact that the company or the business that you're volunteering or working for, they can't say that you will be protected or safe in these situations if something were to happen, if somebody were to get sick. So the best thing that they can do right now is just to stop everything, right? That's what we've been needing to do in the world, is stop everything, slow down, and just take a minute. Just take a step back to see what we can do to better suit the situation for everybody. Work is always going to be there, guys. Work is always going to be there. All right? Insecure, inadequate, or non-existing housing conditions. Insecure. You're not too sure if your landlord is going to up your rent. They can't do that, okay? The government has said that they can't do that. I will find the documentation to provide that information to anybody who needs the help. We have gotten a couple of emails at the office in regards to that, I think. And if not through them, I think the Alberta government website actually does discuss that. Yet again, that is where most of us get our information. Don't quote me on that. I'm not too sure, as I can't remember right off the top of my head. But there's a lot of things that cannot be done in regards to housing at this point in time due to the situation. A lot of people, a lot of places, a lot of businesses have said if we're collecting mortgages, that those mortgages can slow down. Not for me, but for some places, absolutely. Okay. Non-existent housing conditions, people who are homeless, people who have no home, right? What do they do in this situation? That's a continuous reoccurring question for me. How would those people in the community be able to survive in this situation at this point in time? Most of the time, the mustard seed is open for them to go and get food and stuff, or for them to sleep at night. At this point in time, I don't know what their services look like, but I'm sure it's very difficult, right? So I could only imagine. So that kind of falls under inadequate and non-existent housing conditions, right? I mean, I can only imagine what the homeless people in our community are going through. So let's keep that in mind. Ongoing specialized medical care or needs specific medical supplies. So some people are very sick and they're sick all the time and they need like medical supplies or an oxygen tank or something like every 2 weeks. Some of those things you can stockpile. There's other things that you can't, and you need to get them ordered or delivered at a specific time. On the website, it said that these people are the most vulnerable, and it could be for multiple reasons, right? Specialized care, if you're a cancer patient, how do you go into the hospital for chemo? What's the safest way to do it? For moms that are pregnant, what is the safest way for me to have my baby, right? So a lot of different needs are needed. A lot of specified medical supplies was also mentioned. So again, oxygen tanks and stuff like that. How do we get that ordered? How do I get that dropped off so that I don't have to go into the community and pick it up? Or is there a good time for me to go and pick it up, right? So all of that stuff. And even then, if you're getting specific medical supplies due to you not being well on a regular basis, it will probably be best for that person to get somebody else to pick it up for them. But what if that person doesn't have anybody else, right? What if they depend on the nurses or the practitioner nurses that come into their house once a week? So social or geographic isolation, like in remote and isolated communities. We have a lot of remote and isolated communities in Alberta, from what I've learned over the years. We're living in central Alberta, but there's smaller areas that don't even have police, don't have hospitals, don't have medical centers, that are an hour out, an hour and a half, 2 hours outside of Red Deer or Edmonton or Calgary, right? There's enough medical centers for sure, but some people do have to make a drive, especially if they're sick, right? So providing services to those people on a regular basis, finding out what's happening with those people on a regular basis may not be the easiest thing. And they could also be in quite a vulnerable situation, especially if they're not following the rules. How is that monitored, right? How's the government able to monitor if there isn't police in that town, or police driving through that town regularly to make sure that the businesses are shut down that need to be shut down, or people are not congregating and gathering like they're not supposed to be, right? So yeah, being in a remote or isolated community, that can be a problem. That's a reason for being a vulnerable person. Difficulty reading, speaking, understanding, or communicating. So the easiest way to explain that is for the people who